Hello, today is April 15, 2022. My name is Mario Praslini. I am interviewing Pedro Coronado for the University Library Special Collections and Archives at the University of Texas here, Rio Grande Valley, hereafter abbreviated as UTRGV. This project is in partnership with the Voces Oral History Center at the University of Texas at Austin. Please know, Mr. Pedro Coronado, that this interview will be placed in the University Library Special Collections and Archives at UTRGV and shared with the Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. The University Library Special Collections and Archives will archive your interview along with any other photographs or other documentation you are willing to share. UTRGV University Library will retain copyrights or non-exclusive rights to the interview and any other materials you donate to the Special Collections and Archives at UTRGV. Because we're not conducting this interview in person, I need to record you consenting to make sure you agree with our interview procedures before we continue. So I'll ask you a series of 6 questions before we start. Please say yes, I agree, or no, I do not agree after each question. Do you agree? Do you give consent? Do you give Rio Grande sorry about that. Me at a tatso. Do you give University Library Special Collections and Archives at UTRGV consent to archive your interview and your materials at the UTRGV University Library?
Yes.
Do you grant UTRGV University Library Special Collections and Archives right, title, and interest in copyright over the interview and any materials you provide?
Yes.
Do you agree to allow UTRGV University Library Special Collections and Archives to post this interview on the internet where it may be viewed by people around the world?
Yes.
Do you grant the University Library Special Collections and Archives consent to share your Zoom interview with the Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of a Pandemic Oral History mini project, which will include posting the interview on the internet?
Yes.
As you recall, we previously filled out a pre-interview form. We used information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before the Voces sends it to UTRGV University Library, Special Collections and Archives, we would have stripped out any contact information for yourself or family members, so that will not be part of your public file. Your public file will only be accessible at UTRGV University Library. The final 2 questions ask for your consent on what I just described. Do you wish for us to share the rest of your interview in your public file available to researchers at the UTRGV University Library Special Collections and Archives?
Yes.
On occasion, UTRGV Special Collections and Archives and Voces will receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or email with journalists?
Yes.
Thank you for your consent. Your experiences and stories mean a lot to us at UTRGV Special Collections and Archives. I look forward to what you have to say in the interview questions I will now ask. So first of all, Pedro Coronado, I want to thank you for your time. Like I said earlier, your stories and experiences are valuable to us at UTRGV Special Collections and Archives and to our partners at Voces Oral History Center at the University of Texas at Austin. Because you are a frontline worker at Valley AIDS Council Westbrook Clinic throughout this COVID-19 pandemic, and you work to ensure staff is safe and patients do not face another barrier to continue receiving care. And because you are an advocate for equal rights in the LGBTQ community and are very much involved in charitable work within the community, I know you have many meaningful stories and experiences to share on how COVID-19 has impacted these roles you carry on your life. So before we go into the stories of COVID-19, can you please share a little bit with us about who you are, how you wish to be known? Tell us who Pedro Coronado is.
Well, so I've been working in the nonprofit sector for roughly going 20 years. I kind of started very young, at a very young age, working in this field. You know, I love to travel a lot. Besides traveling, that's kind of my way to kind of, you know, de-stress, self-care. So I like to always, learn something different, learn new things. If it's something that I've never done before, I kind of like that challenge to be able to figure things out, as we're trying to fix problems or identify issues or anything like that. So yeah, so you can say I'm very adventurous, either in my personal life and then at work as well.
Okay, thank you about that. Thank you about that. Yeah, and so I know during our pre-interview you had mentioned some things about works that you've done, and so now as I go into the interview, the first part of the interview I'm going to ask you is more questions regarding stories, memories, stuff about COVID-19. When it first came out, the around December 2019 in Wuhan, China, up now to the summer of 2020. So can you share some memorable stories about how you first heard or learned about COVID-19?
Well, first, because it was like it happened right the day before my birthday, where everything shut down. So besides a couple of things, right? Besides planning a little like a birthday party, get together with friends, and then we were also planning a national conference at work, right? So we were putting that together. That was going to happen in April, the following month, before the shutdown. So when we started hearing things in what is September, actually November, between September and November, started kind of hearing that there was something going on, and just kind of kept an eye on it, right? I remember a friend of mine even went to Tokyo, and so around, I want to say October, November. Actually, you know what? No, I'm lying. Probably think even it was like in the beginning of the year. And I just kind of kept keeping an eye on things, watching the news, and primarily because we had a big event going on, right? So there was a lot of planning for it. And then even for my birthday party, like just trying to figure out what are we gonna do and so forth, right? So people kind of like started sending email, like presenters for the conference started sending emails like asking, hey, like, is it gonna get canceled? Attendees were like, hey, is it gonna get canceled? Do you think what's gonna happen? And at that time, just like everyone else was thinking, right, that what they didn't really know what was going on. They're like, oh, it's just like the flu and like not a big deal. Let's not worry about it. And then once it kind of hit the States, when it started the first cases and I believe it was in Oregon or in Washington State, they that's when we started kind of like, raising our eyebrows and be like, okay, we need to kind of keep a closer eye. At the end, I made the decision, to give ourselves a deadline. So we said, you know what, at least a month prior to the conference, we will decide if this is going to happen or not, depending on how things go. So once we kind of started, things started shutting down. Well, before they started shutting down, and it was actually before my birthday. At work, we started having meetings. A colleague of mine and myself, we started talking about, hey, like, we're not really hearing a lot here at work what they're planning to do. This is becoming a little serious, right? So we started talking, and then we called a meeting, and then we said, hey, well, what's the plan? What's going on? We brought all of our leadership together, and then that's when we started talking more about, well, if this happens, we're gonna try to kind of do whatever we want to do, right?
Right.
So yeah, so like all of that was happening right before when all of this was like barely starting to come out.
Right. So there was a lot of stuff going on at that moment. And a lot of people were really not sure about what was going on. So what were some of the early reports or rumors about COVID that you remember back in 2020?
Which is that, right? That it was, well, first it was that somebody ate a bat. And so now, there was like a virus out there, right? And then it was, like, so just that, like, it was just, I kind of like the swine flu kind of, like kind of like that, where like, oh, okay, well, they're gonna contain it, it's not gonna become a big deal. And then, just like, oh, well, it's only really affecting older people.
Right.
And that was obviously pretty much it, right? That there was like the rumors, and there's nothing to worry about. It's on the other side of the world.
Right. No, exactly. I know what you mean. A lot of times in the past, you always think it's gonna be contained and nothing's gonna happen. But now, at what point did you realize this pandemic was a serious life altering event? And like, or did you not think at that point was serious?
Not really. So actually, it like not until kind of hit close to us, right? So not until it got to the U.S., where this the report starting where like they kept pulling, people they were just dying left and right in the nursing homes, where and then as more information started coming out, we're like, hey, this is not just affecting older people, and then younger people started to die. That's when it was kind of like, okay, like this is more than just the flu. I would
Right.
probably say that I was saying, oh, it's just like the flu, even in January, early
Uh-huh.
February, mid-February. That was like, you know what, maybe this is more than just the flu. Um, because now we're getting more information because we didn't have enough information.
Right. Yeah. When the beginning, it was not much going on. Um, and then of course later on in the year, that's when things becoming more serious. Now, one thing that was very fairly new at that moment, like in the like around maybe March, where all of a sudden we started having these stay-at-home orders and everything. What do you remember what that was like for you during the stay-at-home orders in 2020?
Can you repeat that question?
Yeah, so like as far as in the early part of 2020, there was that we started having the quarantine, that stay at home orders. What was that like for you to be at home and quarantine and stay, not going out anywhere?
What disrupted everything, right? Like, and obviously I don't have like some, I don't have like I guess like a daily routine where affects other people because it's just really me and my husband.
Uh-huh.
Um, so I'm like, oh, okay, well I can't go to the gym now. You know what I mean? Like, is it a big deal? Not really, right? Like, but for me, I've at least like that's kind of my routine, right? And that's what gets me ready for work, to go to work. But at this point, I'm not going to work anymore because now there's a shutdown, and my main concern really, like how I think, if anything, how it really affected me is like, how are we going to keep providing the service that we provide to
Hmm.
the community, um and, with no guidance really from anyone, like nobody told us, like there was our funders didn't come back and say, oh, this is what you can do to continue providing services to the community, right? If
Right.
anything, it was just like starting to just research and come up with stuff, and figuring things out as we went. So it was just that, it really just kind of like, it threw everything for a loop. So I kind of felt that and I'm sure other people in leadership also felt that way, but I kind of felt that it was my responsibility to come up with something fast.
Right. Yeah, took the initiative to, because since you were not hearing from anybody from the funders or anybody in government as far as what to do, so you took that initiative to do that. Now, since COVID started to now, there has been many news media, social media, a lot of sources out there. What news sources or social media do you rely on to keep informed about COVID-19?
I just, I start. So there's a lot of information out there, right?
Hmm.
And I even kind of teach in some of my sessions that I do for people that go through some of my trainings, where you want reliable resources, right? What are some reliable resources? And to me, it's like, if there's the website does not have a .gov at the end, .edu or .org, even a .org, some of them, like, can be questionable.
Right.
But if there's not a reliable source, like if that's not at the end, I'm not gonna even like pay attention to it, right? So I tend to stick to the news, to like, like CNN and MSNBC, stuff like that, right? Like, well, I will search it there. But at the end of the day, I always kind of fall back into what is the CDC reporting. Because that's the only, I'm not gonna follow anything else, because that just is gonna create hysteria, and it will create doubt, and you don't even know, and they're not reliable resources.
Right, get you. As far as you mentioned that you would rely on CNN and that, what makes you prefer those news sources?
Because even though they sometimes provide information that is maybe not correct. Not that it's false, but it's just not correct because they didn't have the correct information. They will obviously go back and they kind of retract that information and put the correct information out. Some other news outlets, they tend to just sway you into what their demographic is, you know. So, for example, Fox News, right?
Right.
What I'll call faux news. It just tries to. It's basically like it's propaganda TV, right? So where it tries to sway your opinion towards a certain way. Where what I've noticed, and what I was doing at that time, I was even comparing. Like I would jump from one station to the other,
Right.
and I would notice the difference. Where like even with like MSNBC, with CNN, like ABC, like those, it was just very neutral. Like right, you know. And at the end of the day, you know, it was reliable. They had reliable people on there. They had people from the CDC. It wasn't just some random person that decided to have an opinion.
Okay, yeah, no, I get you. I understand what you're saying. So they did the research, and that's kind of good for people to do that. Because unfortunately, during this time, many people would just believe some of the rumors or like you mentioned, the fake news. But can you share with me what you understand about COVID-19 as an infectious disease and how you feel it's impacted society?
Um, well, it's like any other disease now, right? To where it can be like it's like the flu. I will
Mhm.
say that, right? The flu has killed thousands and thousands of people in 1 year. It, you know, killed thousands of people, right? Every single year.
Right.
But people didn't really pay much attention to it because, and they have never really paid much attention to it because it just, you know, there's vaccines, there's, you know, over the counter stuff that you can take, and for the most part, you know, it's just common, right? And I think with COVID-19, it's gonna become a common. I know there obviously there's mutations of it. I know that, you know, it's gonna keep evolving. But as the virus itself evolves, science will evolve, and you know, overall, like at least like the scientific world is not just gonna like say like, whatever, let's just let it take its course. They're
Right.
gonna do whatever they can to make sure that, you know, to save humanity at the end of the day. So, you know, like HIV, for example, we learned to live with it, right? And that was a pandemic. And obviously, like, you know, medications came out, people are living longer. There's now ways to protect yourself from not, you know, contracting HIV. And I'm pretty sure that's going to be the same thing with COVID-19. You know, where they're just going to come up with stuff that's going to protect you, like they have been, like with the
Right.
vaccines.
Right. No, I get you.
Well, not that you're not going to get it, right? But at least it's not going to kill you.
Right, exactly. Those preventative methods, measures that people will take, kind of like HIV. Interesting that you mentioned that you compared COVID-19 to HIV as far as a pandemic, which actually it leads to one of my questions. Um, how would you compare those two? Because, you know, back when HIV first came out, not much media or not much focus was on it. All of a sudden, COVID comes out, and within a month, I mean, within a year or so, there's a vaccine. How would you compare those two regarding?
Well, and I think it didn't have to take a decade for the government to pay attention to it. But in the beginning, if we think about it, like who was it really affecting the most? It was older people.
Mhm.
So if you think about it, people like, you know, might sound kind of morbid, but like, you know, people were just, well, you know, they're older and eventually they're gonna die, right? So kind of thing. Like, so they probably, because in our society we don't respect our elders and we could care less what happens to them when they get old, you know. Um, so if this was just kind of like, well, you know, they're vulnerable, they're gonna die eventually anyways. People in the what's it called, in the homes and stuff like that, right? But it took like maybe like a month or like for
Yeah.
the government to kind of be like, well, wait a minute, like, no, this is spreading like fast, and I'm sure they're already working on it. But I think the difference here is that it was affecting um just the general population, as opposed to HIV, it was affecting gay men.
Mhm.
So, you know, there's a history with the US government to where they, they didn't even allow for you to work with, to be part of the government, to work with the government if you were somebody who identified from the LGBTQ community, right?
Mhm.
So because it was affecting gay men and it was a minority that nobody cared about, especially the government, that's why it took them over 10 years. And that's why the community had to rise up and be, hey, like, we're dying kind of thing, right?
Right.
And with COVID-19, white straight people were dying, so that's important. We want to keep white straight people alive. So because now if you think about it, the ones that is affecting the most, it's affecting um, people of color, right? People with
Right.
like low income, people of limited resources, and then you have white people yelling and screaming, "Oh, why do we have to take the vaccine? Why do we have to do this? And why do we have to do that?" Even though they probably are taking the vaccine and they're doing whatever they need to do, right? But it's not affecting those communities as much as it is the people of color. Um, so yeah, so let's say white straight people. But I'm sure if it was affecting only LGBTQ people or just people of brown and black communities, it probably wouldn't be this much effort put into it.
Right. Yeah. And that's unfortunate, but yeah, I see where you're coming from. Now, with when COVID came out, and even to now, many individuals in within their families, they've had different opinions, different beliefs about, as far as in within your family, do you feel that your family shares the same beliefs about COVID as you do, or do you have members who take it more serious or not that serious?
I have we're like a small nuclear family, right? So
Uh-huh.
it's just my two brothers and well, like my immediate family, my two brothers and my mom. So obviously my mom and I were like super like aware of it and concerned, and like we were on top of it, like when is the vaccine gonna come out? And as soon as it came out, like she wanted to get the vaccine, and obviously she was in that demographic where she was at higher risk. So and myself obviously, well, like I'm, it's science, I'm gonna follow it. But then I had another brother who was just very indifferent. It's like, whatever. And then I had another one who just kind of like wasn't like, it wasn't even like even worse to whatever. It was just kind of like, no, like there's no need for that, or you guys are overreacting and this and that. Even in the middle of millions of people dying, well, over a million people dying at that
Yeah.
time, right? Um, so yeah, so like it was like that. And then with my extended family, with my other brothers and sisters, I have brothers and sisters, they one of them, well, we don't know, the thing is one of them passed away at the very beginning of the pandemic. So when my brother passed away, he they didn't know, he passed away, I think it was because of heart problems, but they didn't know if it, at the same time when um they tested him, once he had already passed away. They were doing the autopsy. Apparently, he also had COVID. So now that what we know of COVID and even causing cardiovascular problems, obviously we don't know if that was like the cause of it, or just because he already had maybe cardiovascular issues, which he did. But strong, healthy person, like um, you know, like in his mid 40s, like so when that happened, yeah, like it was kind of like a wake up call,
Uh-huh.
because everybody, at least in our immediate family, kind of took it serious, right? Like, well, those that didn't, uh, but yeah.
Okay. And so when the when as COVID progressed, eventually the vaccine started coming out, and again, the news media, there was like different discussions, debates about the vaccine, whether it was effective, not effective, whether a lot of rumors. How did these discussions affect you and the choice whether you wanted to get one or not?
Oh, I didn't really have to think much about it. It came out. I knew it was, like, yeah, like obviously I know how vaccines, are processed and made,
Mhm.
and like everything that has to go through. They don't just like make up something and use people as guinea pigs. And obviously there's to every vaccine, to anything you put in your body, there's potentially a risk of a side effect.
Mhm.
But that's the risk I was willing to take, especially, and then, knowing that I had other family members. Right now, there's one of them who's still waiting for a lung transplant because of COVID. So when they got COVID, it was right before the vaccines came out. So knowing all of that, I'm like, you know what? Like, it's either I get, 2 weeks, I might feel sick or whatever, or get my arm's gonna hurt, or I might get a headache, or even at this like extreme rate, right? That I might die because of that. I might die because of the vaccine, or I might die because of COVID, right?
Right.
So it's one or the other. Like, that's kind of how I took it, and it wasn't about me either. It was about even just the people around me. Like, why am I going to be selfish and put myself at risk when there's other people that might depend on me, or so.
Right. It's looking out for the other person, making sure that they don't get sick. Now, so obviously you got the vaccine and you also followed up with the booster shot then.
Yeah.
And so, what was that like for you? Like, was it easy, difficult in terms of scheduling and the wait time?
Um, well, it was easy because since we work in the healthcare field, they kind of gave us priorities. So for me, it was easy. It
Uh-huh.
was difficult when I was trying to book it for my mom. So I was trying to kind of get my mom, so like, yeah, everything was like, oh, you go online, you do this, but my mom doesn't, like, she's not tech savvy. So she didn't know how to go to a website to be able to schedule her appointment or anything like that. So I did it all for her. Um, and that was the only way that we actually got it done right. But I had to do it for her. So I don't think, and obviously you can't tell people to go to this place to sign up for it, because they're trying to avoid mass amounts of people to go to a certain space, right?
Mhm.
So I understand that with technology, it made it easier for some people, but for the most vulnerable people, I think it made it harder for them, which are
Oh,
people who might not be too tech savvy, older people, just so.
and as far as where you got vaccinated and boosted, what can you share about the memory about when you got back, the place where you were at, and also let's say, for example, when your mom said when she went, how was that experience for her?
Well, she said that it was kind of like, it was fast. It was like within an hour, and they were just in their car, and I think they just took their arm out, and then they would like inject them, and then that's it. Like, that was it. Like, so yeah, they waited in line for an hour, but it wasn't bad. Like, it wasn't a big deal. She didn't say anything like that she was waiting for hours and hours in line. And then when we went, like, literally, we just got an email. We said, hey, who wants to sign up? It's gonna be tomorrow. You have to be there at this time. And I went in 20 minutes and another 20 minutes because we needed to wait the 20 minutes or whatever. And then that's it. Like, I left, and it was easy. Like, I had a good experience.
Oh, okay. That's,
And
like,
and for my boosters too, like, I had a good experience because I was shopping at Sam's and I heard that they were announcing like, oh, they can offer it there. And I'm like, oh, pues, you know what, it's time to me to get my booster. I literally just walked over, I scheduled it within an hour, I came back, and then I got my booster.
so there was no long wait time that you have to wait for it and everything.
No.
Okay. So as we move along with the interview, now we're going to start asking you more about how COVID-19 has impacted your life in a way of your career and your personal life. Now, during our pre-interview, you mentioned you've been married to your husband since 2015, of 2015, obviously. And so in what ways has COVID affected the lives of you and your husband?
Well, he's been working from home this entire time since the shutdown. He's still working from home. They're planning on sending them back, but it's still very like it's not clear yet. So other than gaining weight and losing weight, um, I don't know, like, not much really. Like I'm like, maybe I work from home for 3 months, but even at that, like, I think I saw him for some reason. I saw him less when we're both working from home, because I was in one room, obviously, like, working nonstop from like 8 to 10, 8 a.m. to 10 p.m. Just come out to eat and then go back in and then come, like, because we had separate offices. We made bedrooms into offices, right?
Mhm.
So it just, and then after that, like, I was just busy. Like, I just I don't know, like, it didn't make a big difference.
I guess that's the thing with COVID. Working from home, I guess one of the effects was a lot of weight gain and people
Yeah.
find the time to find things to do. But since I know during our interview and even before, you stated that you like to travel. That's something that you like to do as self-care. Um, as far as how did COVID affect any, or did it affect any travel plans for you and your husband in the year 2020 or 2021?
We had a trip booked to where? Actually, we had a trip booked for, I think it was for the World Pride event, and it was gonna be in May or something like that of 2020. So obviously that got canceled. We got all this credit, right? Like a bunch of credit, right? Um, we When did we travel? I want to say obviously like, and then that passed, right? So we actually decided to travel once they were like starting to open up things here and there, like in at the end of the year, close to the end of the year. And I actually liked it because the planes were empty. The places we were going to, like, they were empty. Yeah, maybe a lot of things weren't open, but we were at a beach,
Mhm.
so that was, fine. Um, yeah, like we have a pool, so so we spent a lot of time in the whole summer. Obviously during the pandemic, we spent it in the pool, so we got to use the pool a lot, which we always do every summer, but this time even more. Um, yeah, like that's we just made it work with what we had. So
Okay. Now, as far as I know, in during our pre-interview, and even actually a few questions back, you mentioned about the individual that passed away because of COVID. Um, Generally speaking, as far as how was that experience for you, him passing away due to COVID?
well, like I said, we were kind of like we don't really know, but we like haven't, like at the end of the day that they had COVID. Um, it's just like I don't know, like I can honestly say that I still haven't processed it yet. So like it
Okay,
hasn't really like I don't think I've had the time to process it. So
I see. Now, another question I had asked you during the pre-interview is regarding the LGBTQ community. So in the LGBTQ community, a lot of times, especially here in the Valley, like where there's McAllen, Harlingen, Brownsville, many of those individuals, there's not that many safe spaces for that community where they can be themselves, where they won't face any homophobia or any of that. So due to COVID, a lot of bars, clubs, those safe spaces that they go to be themselves, to be with their friends, had to close. What effect did these closures have on the LGBTQ community, especially for those individuals who went to those places to be with their friends, to be themselves, to have that safe space?
ask me that again.
So, like, what effect did the closures have on the LGBTQ community, especially for those individuals that go to these safe spaces, to bars, clubs, because they have nowhere else to go, and that's the only place where they can be safe and be with their friends? How did that affect them?
I think if anything, like I know, like for example, at work we had we had I would help out with the support groups that we had here.
Mhm.
So when that kind of like finished, right? We obviously we did them virtual, right? So we went virtual, but it wasn't the same. Like it just, I think it was that human connection that people needed, right?
Right.
Especially for people that don't have it, right? And maybe that's what they were looking forward to. Same. I think one time we signed up for this um virtual circuit party, like
Mhm.
like a dance party, whatever, but it was virtual. So we're just watching from home. So like I think I always look at the bright side of things, right? There's things
Yeah.
that I probably will never do again. Um, but at least I got to experience them. I say, let me try it. Let's see what it's all about. Worst thing that can happen is that I hate it and I'm not gonna do it again. I didn't
Right.
hate it. Like it wasn't, um, it was fine. So I think people found ways. I think even like they were doing like the drag shows. So when they were doing those virtual drag shows, I would I would look forward to it, right?
Yeah.
Because then we were kind of like still in that space, even though it was virtual. I remember one conference, some national conference. And we were like, usually in these conferences we try to network and all that, right? And I remember like reaching out to people that I knew that were there virtually. And I said, hey, like, let's just set up a Zoom call and let's just have a beer, and let's just kind of how we typically would at a conference if we were to be going to like the bar after at the hotel bar to catch up, right, and to connect. And that's what we did. And I think we spent like 3 hours and just like talking and like, so I don't know, like I just like I don't I guess because I'm not gonna say that I don't need a safe space, because I do.
Right.
Um, but I made my backyard into my safe space, right? So I just kind of made the most of it. And then at least I knew once these spaces were open again, even if it was limited, even if it was like social distancing, wear a mask and all those things. I didn't go because so much because I missed it.
Yeah.
I went more to support them because
Yeah.
we knew that the financial hardship that, COVID has and still has on a lot of businesses. And I wanted to make sure we supported these spaces one way or another.
Right, I understand. Yeah, there's a lot of business that were closing, so they needed that financial support from individuals to survive. Now, as far as obviously because in COVID 2020, a lot of the normal holidays that people celebrate, had to be not celebrated. So or have different way of celebrating. How did COVID impact your family life or even your husband's family as well, for the ability, as far as to spending Christmas or New Year's or Thanksgiving with them?
Well, it was kind of sad. Well, on my end, we're never really together with my family, like on
Mhm.
my side, because they all live some live in Dallas, some in Mexico, so for me, it's always a phone call, like, hey, Merry Christmas, hey, Happy New Year, whatever, right? So we'll send gifts, right? Like we'll mail gifts to each other, whatever. So for me, that's normal. Like it didn't really change anything other than I was planning on going to spend the holidays, right? Sometimes it works out, sometimes it doesn't. So it was just one of those things that, well, it didn't work out, right? And obviously, we were conscious enough to know that this is not the best time to be traveling and to be, and the last thing I want is to get my mom sick.
Mhm.
So I said, you know what, like, there's no need for it. At least with my husband's family, they always meet for every single holiday. I think for them it was hard, not being able to connect. And I think, but at the same time, what I really liked is that they kind of like, even though maybe the siblings wanted to meet, they were like, no, like we're not gonna meet. You're basically like you're not gonna put us at risk.
Right.
Like you mean like,
Yeah.
so yeah, so we knew what we had to do, and it is what it is. That was kind of like the attitude of all of us. Like it is what it is. It's not gonna last forever. Eventually, things will go back to normal.
Okay. Yeah. And now during 2020, especially around the beginning stages of COVID, or when people still were unaware of what it was or how it affects people, many people, there was all that paranoia, the hysteria where people will go out in public, that's to a store, to wherever, and the moment they heard someone sneeze or cough, is the first thought in their head. It's like, oh, like, oh shit, what's going on there? But how concerned were you when you would go somewhere in public and you heard someone sneeze or cough? And what went through your mind at that moment?
Well, yeah, like, do they have it? Like everybody would kind of look, or even when I would like sneeze, and then like I knew it wasn't COVID, like, but it was kind of like, man, hopefully they're not gonna think I have it.
Yeah.
Like you walk around thinking, oh, they're gonna think I have it, and then they're gonna shun me away.
Right, right. And unfortunately, I think that sometimes we're doing some research that there's still people out there who have that same feeling when they go out in public right now. Now, as far as back in 2020, the spring of 2020, um, I don't know, do you remember the food shortages and the toilet paper outages in spring 2020?
Yes. So I think luckily we had just purchased like a lot of that stuff what we needed. The only thing was food. So because we were at that well, we were at that time we were still doing keto. So obviously like some of the food that we get, like it's not just like just anything. So that's why we just kind of said, you know what, at this point it doesn't matter. We just need to get whatever food we can get. So I think what we did, we overdid it. We
Mhm.
got everything that we wanted to snack on that we couldn't when we were on keto. So we just kind of use it as an excuse, like, you know what, well, if potato chips is all there is, like, that's what we're gonna eat. And we got like a bunch of bags of potato chips. Because, and also we just didn't know, like, well, what if like there is gonna be even more of a food shortage, and let's at least get what we can get now. But at the same time, we didn't hoard, because we knew that, you know, like, well, what if nothing happens and now we're gonna be stuck with all this food? And there's other people that need food. Like, we can't just take everything and not allow other people to get some.
Okay. So that kind of changed your shopping routine, going from normally buying your own stuff to buying whatever, not that what was there, but just pretty much, if you make the best of it.
Yeah.
Um, so like as far as we go further, the next question I'm going to ask you is more about how COVID has impacted your charitable work and for the LGBTQ community. You had mentioned that you do a lot of work, charity work in the community as well for LGBTQ community. During our pre-interview, you mentioned that you were involved in some charitable work and leadership community programs. Can you please share about these organizations and how they have helped the specific community?
So yeah, so I try to like get involved in as many things as I can, right? Help out other organizations. We started a like a bear, I think, yeah, it was during COVID. And actually, I forget what year we're in, but I think this is like in late 20, I mean, it was like in like spring of 2021. Um, and at this point, people are already traveling, but still, obviously, with the whole COVID stuff and everything, and the vaccines, like, I think, obviously coming out and all that, right? So, we started a group, and then it's just kind of the idea came of like, hey, let's try to, like, now that people are starting to kind of do things together, why not, so we basically created a group for men, or men, or people who identify maybe as men or trans men, and that are from the bear community, right? And this is like an LGBT group. So everybody's welcome in reality. So, and this group was just to kind of like just bring people together, to raise money for organizations, for body positivity. And a lot of it was because also, like, after COVID, right, or during COVID, a lot of people gained weight, or people lost weight. But it was this whole thing about body positivity, and just kind of like, trying to support each other in one way or another. So we started the group, and we threw events, and people came together, and like, I think it helped a little bit. I think, in a way, like, if it wasn't because of COVID and everything that was happening, I don't think it would have had the success it had for some of the events that we threw. Because people were wanting that connection, right? And in a way, like, even we did stuff to raise money to buy Christmas toys for kids, and so it was just like other excuses. We were like, oh, what's your charity? So I'm gonna go to that event, right? So
Right.
I think that pretty much helped. And then we kept pushing also the message of like, hey, we're having an event. It's better that you're vaccinated, because the last thing we want is for you to, like, in all honesty, like, get sick and potentially die, right?
Right.
So because we care about you, come to our event, but come vaccinated, right? So.
Okay. And so as far as your professional life, your work life, you had mentioned that as far as an organization you work for is called Valley AIDS Council, Westbrook Clinic. Can you tell us a little bit about them as far as what kind of services they offer and what your role is in that in agency?
So my role keeps changing all the time, right? But at least for the most part, what I'll say, with the Valley AIDS Council Westbrook Clinic, at least right now, my main focus is on not only development within the organization, but also outside of the organization, to make sure that our our staff has the support they need in order for them to meet the goals and requirements of the grants, and that they get, like, the training, the trainings that they get, the trainings that they need, that we build processes that are going to work not only for the staff but for the clients as they're coming in to get services. So with the Valley AIDS Council Westbrook Clinic, right? So we are an HIV nonprofit organization. And in reality, we provide just sexual health services. Obviously, when we talk about the services that we provide, if you think about it, you know, people might have thought, oh, well, you know, because of the social distancing and because of, you know, having like the shutdown and stuff like that, there was probably less sex going on, and because of less sex, less of transmission of STIs and HIV, but not necessarily, because people got tired of it and people were still like, you know, hooking up and doing whatever they needed to do, because they were still missing that emotional connection, right? So that's the way they got it. That's the way they got it. So I've been working here for like almost 20 years. I've done a little bit of everything. Everything from outreach in the streets to, you know, now writing grants and helping with, you know, development. Um, so you know, I don't know if that completely answered your question.
No, yes, it does. This answers our question. So, and when we started the interview, you had mentioned that um, you and some other individuals in the leadership position had to take the initiative to figure out, okay, what's going to happen next? What are we going to do next with regarding COVID? What precautions has Valley Aids Council taken over the last 2 years during COVID to protect its employees?
Yeah, I think we like this is the very beginning. Like we just for whatever, you know, we try to follow CDC guidelines and everything, right? Whatever was being put out there, but you know, even us ourselves, we just kind of like in the very beginning, we said, you know what, like if people have offices, they stay in their offices. If people can work from home, let's send them home. You know, like so they can work from home and they don't have to be coming in. Um, you know, just making sure continuously, you know, besides testing people for COVID, providing them with the proper PPE that they needed, um, to making sure that if it's a job that you have that you need to be talking to people, that and if that's something you cannot do, try to find them to do something else,
Mhm.
you know, to keep them employed. Because in reality, there were some positions that we had that and we're like, well, they can't do the work that they do because they need to be like talking to people physically, they need to be in front of a person. But we found things for them to do and in a safe way, right? That they can be able to do from home, from an office by themselves. You know, like I think
Right.
even till now, they're like they have to make announcements of clean your areas around you, right? Like, and then we provide all the cleaning supplies so people can just clean everything around them.
Okay. And so now, from my understanding, Valley Aids Councils, you all receive public dollars, state funds, and federal funds. During COVID, what actions did you all take to prevent from losing these funds, or did you all run the risk of losing them because of the whole pandemic?
No, because I think if anything, our funders knew what was going on, right?
Mhm.
Obviously, we told them what we were doing and how, like, we told them what we were gonna do to continue to provide services. Um, if anything, more money came in,
Okay.
because of what we were telling them, and obviously it wasn't just us, right? But nationally, right? If we're telling people, well, you know, people are losing their jobs and they can't pay their rent, people because they can't go work, right? Because things are
Right.
shut down, so more money came in for that. Or, you know, hey, we're going to be doing telehealth services, we need more equipment, more laptops, iPads, whatever it is, right? um, then they understood like that, okay, well, we need to give more money. So that was a good thing that came out of this.
Hmm.
There's a lot of projects that we've always talked about doing, like at home HIV testing kits. I remember, and actually, I was going to some of my stuff, and I found the box of an HIV home testing kit from Arizona, and this was from back in 2018, 2017, something like that.
Hmm.
That I had already started doing the work on trying to establish a program in Texas. You know, and so I went to Arizona, did all my research and everything, and the process was like literally was taking forever. Like it was one step after another, after another, after another. And the pandemic had to happen in order for home HIV home testing kits to happen from one day to another. Like, yeah, we have to develop all these different, like, you know, processes and everything, but it just seemed to be expedited, like super quick. Where I'm like, we spent all these resources, you know, we try to, you know, make people understand this is something that we can do.
Right.
And but the pandemic had to happen. Same thing with with the telemedicine and telehealth services. We had just started doing telecase management with our youth, with our youth caseworkers,
Mhm.
and that was working. And then we were trying to expand it to everyone else. The pandemic hit, and we had no choice than to actually do it. So I think if anything, in a way, like for our funders, we told them what we needed to do. We said we need to do these things, but you need to work with us and get these things done fast because we can't wait. And they
Right.
obviously do that. So
Right. No, so it sounds kind of like the pandemic. In order, because it happened, it had to really, a lot of things have to come up quick and adapt to it real quick. Things that were being planned years ago that finally had to be done within the next few months, such as telemedicine. Um, so when you started doing telemedicine, what challenges did y'all have to overcome to make it successful, and especially to provide the same service to the patients as if they were in person?
well, first is getting the staff to understand the technology, which,
Mhm.
I can come back and say it's not that difficult. It's super simple, right? But obviously, I was already using the technology we're using for telemedicine. I was already using it for other programs.
Mhm.
And we had already started using it for telecase management as well. So, and then having to then explain it to the client, to the patients, right? This is all you have to do. Obviously, for us, it's simple because we're using it, but they weren't. And not just understanding on like how are you going to do a visit without even me physically being there, because that concept, a lot of our patients, the majority, I would say, probably never have done a telemedicine consultation before. So I think that was kind of like the I don't say hard part, but like it was a little challenging.
Yeah.
But at the same time, because people knew that it needed to happen, even the patients learned it real quick, right? Because they're like, okay, well, this is not the only thing that I'm gonna have to do virtually. I'm gonna have to do other things virtually. So they learned it. So we actually even created like opportunities for us to be able to teach them how to use it. We would tell them just come to the office, stay in the parking lot, and if somebody's gonna go out there and they're gonna teach you how to use it. And once we, you can just leave after that, right?
Right.
So we tried anything we possibly could just to make sure that they were able to know how to use the technology, not only for the patients but for for our staff as well.
Oh, okay. So like in the valley here, we have, um, you know, the border area is known to be not as very kind of marginalized compared to the rest of the country when it comes to education, language, health wise. But for those, so basically for those individuals who are not very tech savvy, was it very easy for them to adapt and train them so they can get the same services as if they were there in person?
Yeah, like we would always come back and say, like, oh, who created your Facebook account, right?
Mhm.
Or who created your Instagram or whatever? Oh, pues I did, right? I did it. Okay, well then you know how to use your phone, you know how to download things. I said, so we're gonna walk you through this process. It might not be exactly the same, but you just have to download an app, kind of how you downloaded Facebook on your phone, and that's kind of like the concept that we will use for everybody. They're like, oh, okay, okay, okay. And a lot of people, even with WhatsApp, because here in the border we use WhatsApp a lot,
Uh-huh.
especially if people have to communicate with their family members right across the border. So I would be like, okay, do you know how to, did you who downloaded WhatsApp? Is like, oh, pues I did, right? I'm like, same concept. Do you know like you can use the you can do a virtual call on WhatsApp? They knew how to do that, right? So we just kind of like followed that and said, you know what, like download this. You're gonna enter this number. And I remember one person, it took me 4 hours
Uh-huh.
for them to get to like finally understand it. But after that, they got it. They had no problem. They knew how to log in. They knew what they needed to do. So it wasn't that difficult. Like, I think if anything, even the people that we least expected that they were going to be able to actually connect
Yeah.
virtually, they got it super fast. And the good thing too is that we're very resourceful, right? So we would tell them, okay, well, if you can't, is there somebody in the house who can help you download this or whatever? And yeah, and for the most part, they would always find somebody. Like,
Okay.
oh,
So they got the hang of it real quick then.
yeah.
That's good. So you had mentioned earlier about a conference you were organizing around March, which basically when you do set up a conference, you have to plan a year ahead, to making sure everything is perfect by the time the conference starts. And the conference is the National Latinx Conference on HIV, HCV, and SUD. Is that right? Correct?
Yes.
Okay, so tell us a little bit more what that conference is about.
So this is a conference where we bring in anybody who provides services to people who are at risk of contracting HIV, acquiring HIV, or people with HIV, and so they can live long, healthy lives, right? And this also involves, substance use disorders and hepatitis C as well. So the whole concept behind this is so we can be able to provide training and education to those providers, anybody who provides that service to individuals, to provide them with training and education that's culturally appropriate, to be able to provide a better care and services for the Latinx community, so linguistically and culturally appropriate.
Okay, so basically it focuses more on the Latinx community that a lot of times gets very much underserved nationwide. So in this conference, back from what I see here in the research, it was supposed to happen around March, around that time. When, and I think you mentioned that earlier as well, when all of a sudden you had to say, you know what, we're not going to happen, and the funders were, the sponsors were calling the presenters. How, as far as like, how did that make you feel? Because obviously there's a lot of work that goes in. Your whole team puts in a lot of work and effort into making sure this conference is very successful. I mean, if I'm not mistaken, I think this is your baby. This is your big project that you focus on, and you take pride in it a lot. But how did you had to come to terms that I'm gonna have to not continue this conference? All that work is pretty much went to nothing because of this pandemic. How did that make you feel, or what was going through your mind at that moment?
Actually, in a way, it was a big weight off our shoulders because we had to deal with trying to figure out what's going to happen because of the pandemic. In every single conference, we start planning a year in advance, but it never fails that we're always at the end trying to do last minute things, right? People canceling. So when obviously like a month before the event, little by little, presenters were canceling. They're like, hey, like my job just basically said I can't travel anymore. Or, hey, like I don't feel comfortable going because, I have a parent that I live with and this and that or whatever, or, or I have, underlying issues. So once I think it took like the fourth or fifth presenter that canceled on us, where we said, okay, this is it. Like we're pulling the plug because this is going to just snowball, right? And then even attendees were already starting to ask, some of them were asking for refunds. Right. So I think it took like 2 refunds also for us to be like, you know what? No, we're canceling this. Or when you say we cancel, we're going to postpone this and let's see what happens. And we're going to push it, So in a way, like, yes, it was a lot. We were like, man, like all this hard work and effort we put into this. But real quick, we were like, you know what? But we don't have to deal with it anymore right now because we have other things to deal with. So.
Okay. Now, since then to now, is the event back to normal since like in 2022 and 2021, or how long?
In 2020, we just completely didn't have it. We just canceled it. We focused obviously on other things. We still had to put educational activities together. So we just focused on other things that were all virtual, right? In 2021, we were going to have it in 2021, but it wasn't looking like anything was opening up. And then we just decided to do it virtual. I said, you know what, let's just do a whole virtual conference. That was a first for us. We learned a lot from it. It went well. It went as good as it was going to go. And then this year, maybe like a month ago, less than a month ago, we had our in-person. It was a hybrid event, right? So we didn't know how many. We actually had more people come in person than joining us virtually, because we realized that people are already hungry to have face-to-face meetings.
Right.
Obviously, we're telling people come vaccinated. It went well. I think it went really well, better than I expected in a way, especially because people showed up in person.
Right. Okay. Now, there's another event that Valley AIDS counsels. I guess it's in partnership with STEP, which is South Texas Equality Project, and this is Pride in the Park, which happens around June. As far as with that, how was that affected? And I want to say, I think not so much in part of it, but you kind of help out a little bit with that.
Yeah.
How did COVID affect that event?
I can't remember. I think they did like a virtual thing. I
Uh-huh.
just can't remember what it's a blur, to be honest with you. 2020 and Pride. I think they
Right.
did like a bunch. I think they did like a drag show. I can't remember. They did stuff, right? So at least I know that in 2021 we actually had an in-person event.
Okay.
And there were some components to it that were, because it was hybrid. It was actually a hybrid event, I should say. Some educational stuff that happened. We did a hybrid. Even I want to see even the drag shows we had them. They were hybrid, where they were being streamed live through Facebook. Um, but um, but yeah, even at that, actually, like we had a lot of people that showed up, and this was in June of 2021, right? So obviously, people were still like either not vaccinated or were already vaccinated. We were still asking people to wear masks. Uh, you know, they allowed us to have like an in-person event. I think it went well, at least under the circumstances. If we had like
Mhm.
maybe 300-400 people in that space and a bunch of vendors and like it, yeah, I think maybe we even had more. I can't remember how many people showed up, but it went well, I think,
It went well.
under the circumstances that we were in. And I think at the same time, people were like wanting to have like that interaction.
Right. And is the event back to normal in 2022?
In 2022, it's back to normal. It'll be an outdoor event, right? But for the most part, I think it's gonna be the same as pre-pandemic.
Uh-huh.
Um, it's the way it seems and the way it's going, the planning is going right now. It seems
Right.
very like back to normal. I think
Okay.
we're having a pool party or something. I don't know. So it's very back to normal.
And just to give us a little background, can you tell us what exactly Pride in the Park consists of, or what the event is focusing on?
It's just to kind of bring awareness on some of the like that there is a community in the valley that identifies as LGBTQ plus, right? That part of it is to not only educate people who provide services to LGBTQ people. That's kind of where I come in,
Mhm.
and our team, and then but also to communicate even just the community itself, right, on things that they feel are important to them. Things from everything like, hey, how do I access trans affirming care services, right? How do I bind? How do I talk to my son, my children about, because they just came out to me, like stuff like that, to
Yeah.
where like we're providing training to doctors on how to provide better care for their patients in a more affirming way, right?
Right.
So that's one piece, right? And then when we're talking about the actual community event, like the actual Pride in the park, and like sometimes it happens in a park, in an actual park, and sometimes it's like in a convention center.
Uh-huh.
But it's getting all these resources, getting all these like people that provide services to the community, vendors and like things like that. LGBTQ owned businesses, they get to kind of like be highlighted in some of these events. And it's a family event, right? So we want to make sure that it's a space where people can come be themselves. I think for the most part, it doesn't matter what age you are.
Mhm.
It's like be in a place where you're surrounded by people that are not going to judge you and they're just going to love you for who you are. So
Just a very accepting space for individuals. Okay. So as we move towards the end of our interview, these final questions, they're basically ask you to share stories about how have the pandemic affected not only you, but also the response of local, state, and national officials. How satisfied do you feel with the local response to COVID-19 in Harlingen or in Cameron County or in the Valley for that matter?
I think, like, I'll be honest with you, I think it was like, I think even now, like, at least from what I heard, I don't have children, right? So, but I heard that even the schools are still not all back in, right?
Mm-hmm.
Some are not, I don't know. So I think they did as much as they possibly could. you know if there was a mask mandate, great. Like, I think even like just local store like HEBs, right, where like the ones that started with the mask mandates, we feel like they're the ones that kind of took charge before even our local governments did.
Mm-hmm.
um So, but I think they did as much as they could. I think here in the valley, we kind of it seems like we kind of followed what the CDC was saying for us to do. Um, I don't like we did the best we could, and
Okay.
I don't think it was anything bad. Like I don't the government wasn't coming back and saying like at least our government, which is
Yeah.
weird, but still like they weren't coming back and saying don't wear a mask or don't get vaccinated. If anything, they're pushing for it, and they were like they themselves were wearing masks. They themselves were getting vaccinated. To now if the mass group of people wanted to go against that, then that's up to them. But if the government is saying do this, I prefer to be called a sheep than to be in a casket because I decided to be a sheep with another group of people that were just trying to go against what just healthcare officials were saying. And that's what the government was doing. They were just following what the healthcare officials were saying.
Okay. And are you satisfied with the state response to COVID-19 led by Governor Abbott in these last couple of years?
Yeah, I think there was one point to where I think they were like just trying to say, oh, there's certain things that I didn't agree with, right? Where like that we couldn't mandate people to wear a mask or anything like that in certain spaces. Obviously, those are kind of things that that yeah, like I didn't agree with. I think even in the schools and stuff like that, because I don't have children, so I'm not so invested in that, right? But at the same time, when I hear it, I'm like, well, I don't have to have children to know that, why are you making it like hard for the teachers, for the administrators, where they want to keep everybody safe, and you're saying no, like, oh, they don't have to wear a mask, kind of thing. But there's some other things that if they're pumping money into more vaccines, more outreach, more education on COVID-19 and the vaccines, I'm like, that's great. That what at least our state officials were doing. Um, but that's only on that part. On other stuff, I really disagree some of the things that they're doing. So
Right. Right. And how do you feel about the national response to COVID-19 led by President Trump in the year 2020 and then by President Biden in the year 2021 to the present?
actually, like I would say, I think when was it? So it started in 2020. When was Trump out of office?
Uh, the towards the end of 2020.
Yes. So I think they did well when it comes to supporting those people who were losing their jobs.
Mhm.
With those stimulus checks and all that. At least I was fortunate enough where, okay, I got a stimulus check, but did I need it? Not really. I didn't need it, right? I still took it, right? But I think at least with that administration, I'm glad they looked into that. Also, they put a lot of money into so many efforts to find a vaccine. So the administration in itself, they, you know, they did whatever they could, right? Now, the messaging that was coming from the president at that time with Trump was very contradicting with what his health officials were saying.
Mhm.
So at least, but at this point, I already knew not to listen to him, to listen to what the science is saying. Um, and then now with Biden, yeah, like there was some like mixed messaging, after a while, but it's like I think we're coming to that phase of where like we're trying to get over that hangover of COVID. And things right now are between like I still have that headache,
Mhm.
but yeah, I'm getting over it. Um, and are there still resources that are needed? Yes, and I think they're still providing a lot of resources for it. So I'll just go back to kind of saying that, I think they're just following what their health officials are saying,
Right.
and that's all they can do. And as long as they provide us with the resources, and I think they are, at least I know on our end, in our sector, they are providing us with those resources to be able to continue the work that we're doing.
Okay. And if you had the power of a political office to respond to COVID-19, what would you do differently?
I don't know. I guess because I wasn't dissatisfied with how our government, local, state, national, federal,
Right.
how they handle things. You know, if Fauci said in the beginning, "Oh, you don't have to wear a mask," and then a couple of months later said, "Oh, yes, you do." Um, I get it, like, because I was saying, oh, it's just a flu, not a big deal. And then a couple of months later, like, oh shit, like, sorry, like, oh crap, this is a big deal, right? So like, I don't think I would, there's nothing different that I would do than what our officials did. Like, um, some states went like hardcore, like just shut down everything mass, and even to just recently, right? To others were more lenient, but everybody did whatever they thought was best.
Okay. And so this year, 2022, is actually midterm election voting year. First of all, do you plan to vote? Are you someone who vote?
Yeah.
Okay.
Yes.
And what issue of COVID-19 is going to factor into your votes?
I think the continued money that's going to be allocated towards research. I think that's kind of like, if there's a politician that's saying, oh, it's done and over with, like we don't have to worry about it anymore, then yeah, no, like you're completely like living in a fantasy world. I think regarding to COVID-19, as long as it's just money being poured into resources, because we realize that with HIV, for example, funding has been like the pandemic hasn't like people have still been getting HIV and dying, and the numbers hadn't gone down to maybe just as recently as the past couple of years, but because the funding was the same, and actually I think barely the funding started going up a little bit, not a lot. But that's if no funding is being pumped into this, we're gonna have another crisis again.
Okay. And so like as far as with COVID, is there any sort of help or aid you could have used at the peak of the COVID-19 pandemic to make your life more manageable or less stressful?
No, I was one of the lucky ones. I think that I had everything that I needed,
Uh-huh.
and it didn't disrupt much of my life. So I think I was one of the privileged ones.
Okay. And so like I mentioned earlier in the interview, this would be it's being recorded, so it'll be archived for future generations, in case whenever, let's say, they want to do research about how COVID affected our area here in the valley, in the Rio Grande Valley, in the border area. And so what impact or purpose do you hope the story may have to listeners from the Voices of the Pandemic digital archives?
It's gonna happen again. There's gonna be another pandemic. You're probably gonna be researching this because you're going through another pandemic
Mhm.
of some sort or another, right? We went through one. Well, I wasn't born yet, right? But in the early '80s, right? We had HIV/AIDS. Before that, there was Spanish flu. Obviously, in between that, then there was like polio and like all these other things, right? So there's always something that's going to come back up again, and it's going to affect humanity. It's how we deal with it, I think, that we need to really focus on. And yeah, people are going to try to divide us, and especially in the opinions that we have. And it just takes one person to cast doubt and make you think something differently. But at the end of the day, like, it's not about you, it's about everyone around you. That's, I think, how we need to kind of have the approach of when we're going to address the next pandemic of whatever that is. It's how it affects everyone around you, not just you.
Okay. Now, is there anything else you would like to share with me about your experience with COVID that I might not have asked in the beginning?
No, I think we covered it all.
Okay. Okay. Well, Pedro Coronado, I want to thank you for your time, for taking time out of your busy schedule to do this interview, to make this interview happen. Your stories about how COVID affected your life, and then with our project would be archived, like I said. And thank you for sharing these stories with us. And I appreciate your time, though, and the hard work that you do, though.
Thank you.
Thank you.